Hey lovely people, welcome to Learning with Violet Okolacha, and in today's video we are going to be looking at Professional Value series, and we are going to be talking about witness abuse. Before we dive into our topic for today, I just want to give a massive shout out to about 12-13 students who passed their OSCE exam on Friday. I'm super excited. Like guys, my email was all bubbling. 5 of my online students and around 7-8 of YouTube channel members who have passed their OSCE exam. I'm so excited for you all. And for those who are writing soon, if they can pass and I can pass, so why won't you pass? Just keep practicing with your friends, keep practicing with your peers, practice with your pillows, video your pillows, talk to them and revise back. Like, you're definitely passing. I can't wait to congratulate you. Just be confident. All skill remains simple and nurses are brilliant. Oh my god, I can't wait to congratulate you guys. Just remember to send me a DM, post it on the YouTube like all who sent me message, the 12 of them. I said to them, comment on the YouTube channel. That's how it is, so that others can feel that they can pass too. And number two, I've added the join button for channel members. One benefit of being a channel member is when you ask me any question, it comes with a star on your name, so YouTube keeps prompting me to answer that your question at all costs. So I have to answer you whenever you ask a question. Number two, for channel members, there are some exclusive videos. Like, I remember a lot of people having issues with nutritional assessment, but I say I don't have time for class. If I send them to those videos and they're like, oh my god, I don't even need class after watching those videos. So nutritional assessment video is very in-depth and exclusive, and it's just for channel members. Administration of suppository is in-depth and exclusive, and it's for channel members. So if you fancy watching any of these videos, click on the join button, then you are eligible to watch them and you're eligible to ask me any question. All right guys, without wasting time, let us dive directly into our topic for today.
Ryan Little.
All right guys, welcome to Learning with Violet Okolacha, and like I said, we are going to be continuing with our Professional Value series, and we are going to be looking at witness abuse. So you get a plain sheet of paper just to answer the scenario. A plain sheet of paper. Let me share that with you on the screen. So this is the plain sheet of paper you get to answer the scenario, and the next thing you get is your scenario. I'm going to be reading the scenario from here. I won't be sharing it with you. So you will see it, professional values and behavior. That is the beginning of how it will start. That's your question. Professional values and behavior, and you will see witness abuse. Now, overview. Then scenario. They don't write anything for the overview, they just say overview. Then now the scenario. I am going to read out the scenario. You have seen one of your professional colleagues pulling a patient up the bed with so much aggression, and when the patient screamed, I'm in pain, I'm in pain, she was aggressive and continued pulling patient up the bed. As far as you know, this is an isolated incident. Using your knowledge of the NMC 2018, the code, Professional Standard of Practice and Behavior for Nurses, Midwives, and Nursing Associates, consider the professional, ethical, and legal implication of the situation. Please summarize the summarize the actions you will take in a number of bullet points. This is a silent writing station, so please write clearly and write legibly. And you have 10 minutes to complete the station. If you make any mistake, just strike through and continue. Now, these are my answers for this scenario. Now make sure you read the marking criteria and answer according to your own words, as long as it has the same overall meaning. Number one, I would recognize that my colleague has used an unsafe and improper moving and handling techniques to maneuver the patient up the bed. Tick. I would acknowledge or I would recognize that my colleague has used and unsafe and clinically inappropriate moving and handling techniques for moving the patient off the bed. Tick. Fantastic first point. This is definitely a pass point. Number two, I would recognize that the patient may have suffered physical harm by being forcefully pulled up the bed, and we conduct a full assessment on the patient. So I would recognize that the patient may have suffered harm by being forcefully pulled up the bed, and I will conduct a full physical assessment on the patient and ensure that the patient is comfortable. Tick. Fantastic second point. This is definitely a second passing point. Now, number three, I would communicate with compassion and empathy to reassure the patient and identify that the tone my colleague used was aggressive and inappropriate. So I would ensure that I communicate with compassion and empathy to the patient and recognize that the tone my colleague used was appropriate and aggressive and cause the patient emotional distress. So I'll communicate with the patient with empathy and compassion and will recognize that the tone my colleague used was aggressive, was inappropriate, and has caused the patient emotional distress. Tick. Fantastic third point. And number four, I would acknowledge that it is my professional duty to report my colleagues' behavior to their manager and make a datist. So you have to report your colleague to their manager, writing every single incident that has happened, either written or verbally, and make sure you complete a datist with date and with time. Now, number five, I would raise concern with my manager at any slightest opportunity, either in writing or verbally, and I will be clear and honest regarding all that has happened. Number six, I will document what I have seen and how the step I have taken to deal with the matter. So number six, document, or number six, I'll complete a datist report regarding all that I've seen and the steps I have taken to handle the matter. And number seven, I would acknowledge the need to uphold the standard and values set out in the code, which is prioritize people, practice effectively, preserve safety, and promote professionalism. So these are the sample answers for this scenario. So guys, it is simple. Just use your own ways as long as it has the same overall meaning, and I can't wait to congratulate you. I will see you in my next video. Until I see you again, keep soaring higher, keep passing your OSCE exam. I love you all, and bye for now. Thank you.